Good day, ma'am. I am Crystal Jane Esbusmion, your nurse student from J.H. Sireya State College, Pagadian, and I will be assessing the skin, hair, and nails for today.
First, we need to gather all materials needed for this assessment. And also, don't forget to perform hand washing with antiseptic and avoid contamination. Ensure hands from fingers to wrist and forearms are all wet.
Good morning, ma'am. I am Jade, your nurse for today, and I will be assessing your skin, hair, and nails. Before anything else, ma'am, can I have first your basic personal data?
Yes, ma'am.
Okay, so what is your name, ma'am?
Rogalyn Sano,
Your age,
20,
date of birth,
November 8, 2000,
municipality.
Marcos Octubio.
Okay, so for your mobile number, ma'am, kindly fill up here. Thank you, ma'am. So, how are you, ma'am? How's your feeling for today?
I'm good.
Okay, that's good. I'm gonna doing an assessment for your skin, hair, and nails for today, ma'am. For us to know if you have any skin diseases or any developing illnesses in your body that we need to focus on or get treated immediately. And I can assure you, ma'am, that the result will be confidential and the results will only be discussed formally with other healthcare professionals. I'm going to start out by asking you further questions, ma'am. So, do you have any history or previous experience with skin problems?
No, ma'am.
Have you ever experienced previous problems with your hair, skin, or your nails?
Sometimes it's itchy.
How itchy it is before from the scale of 1 to 10?
8.
Have you ever experienced any fever, nausea, vomiting, or any breathing problem, ma'am?
No.
So before we start, ma'am, I just want you to inform ma'am that I have already washed my hands and it is now clean, and I always practice antiseptic hand rub using 70% alcohol. So for today, we will inspect the general skin coloration of the patient. And while inspecting skin coloration, note any odors emanating from the skin. So as we have observed, the patient has a light brown color of the skin. And from my distance, I cannot smell anything bad odor or any distinct smell. And next is inspect for color variations. So again, the patient has a brown color of his skin, and there are some areas of her skin are suntanned. And inspect for skin lesions. So, for skin lesions of the patients, as I have observed, there are several lesions of her skin or in her face, which is there are also one papullae and several maculae or flat maculae that are no pigmentation. There are no pigmentation on her face, and the skin color of her face is evenly distributed to her skin or to her face. And I will measure her skin lesions, which is the papullae on the right side of patient face. So the skin lesions or the papullae of the patient on her right side of her skin, which I have measured, and it is 1 centimeter. So again, as I have mentioned that there are several maculae lesions of her skin, and today I will gonna observe it using magnifying glass, and if it possible, if we can measure it, then we can. So I have found a maculae which we can measure it. So the patient maculae lesions, which I have measured, it is also 1 centimeter. And today, I will palpate the skin of the patient to assess the texture using my palmar surface with my middle fingers. So far, her face is smooth, there is no roughness, and no pigmentation. I will check also the upper extremities, which is her hands. And so far, it is smooth and there is no roughness or pigmentation. And we will go to the lower extremities. Her lower extremities has no also roughness, and it is smooth and no pigmentation at all. And today I will palpate the skin of the patient to assess moisture using my dorsal surface of my hands. So the moisture of the patient's skin is moist, and today I will palpate also the skin of the patient to know the temperature. Using also my dorsal surface of my hands. Her face is warm. And also the upper extremity is warm. And also the lower extremity is warm. And next is, I will palpate the skin of the patient to assess mobility and turgor. Ma'am, can you please lie down for a while in the bed? And today, I will gonna use my 2 fingers to slightly pinch the clavicle area of the patient to know the mobility and turgor of her skin. And so far, the mobility and turgor of the patient's skin is good. So this time, I will check the skin of the patient on her feet and ankles to determine or to detect edema. And using my 2 thumbs, I will pinch down the skin of the patient's feet and ankles. So far, there are no present edema on the patient's feet and ankles. And this time, I will assess the patient's hair to know if there is abnormalities so that I can provide nursing intervention between her hair if there is possible abnormalities. So, to formally start, ma'am, can I have 2 questions? So, do you have a recent experience using or dyeing your hair?
No, ma'am. No.
Do you have experience curling or straightening your hair?
No.
So, today, I will inspect your hair, the general color and condition. So, as I have observed the patient's hair color is black, and there are also in the areas of her hair slightly brown color, which is inborn, and it is straight, and she has also thick hair. By this time, I will check the skull of the patient if there is present lesions or parasites or sparse dandruff by using medical pin light. So far, the patient's hair is, there is no present parasites, lesions, or sparse dandruff. which I have observed also that it has somewhat oiliness, and so far it is good. And this time I will check the patient's hair if there is abnormalities of her hair growth. So far, there is no abnormalities of her hair growth, and however, there is no lice at all. And lastly, I will assess the patient's nails in order to know or to determine if there is present injury or possible abnormalities of her nails. So before we start, ma'am, I have a further questions to formally start our assessing of your nails. So, do you have any history of the following presence of diabetes mellitus?
No.
Do you have peripheral circulatory disease, ma'am?
No.
Previous injury, ma'am?
No.
Or severe illness, ma'am?
No.
Okay, so no. So today, I will inspect the nail grooming and cleanliness of the patient's nail. So far, the patient's nails are well grew and it is clean. And also at the right side of the patient's nail are well grew and clean. And I have observed already the upper extremities of the patient's nails, the grooming and the cleanliness. So this time I will go to the lower extremities of the patient's nails to inspect also the grooming and the cleanliness of her nails. So far, the patient's low extremity nails, there are also nail polish, but so far, there is no abnormalities. And also at the right side, there is nail polish, but the rest are not. And it is also well grew and moderate clean. And after the inspection of the grooming and cleanliness of her nails, we will go further to the inspection of nail colors and markings. So in upper extremities, of her nails, the color is pinkish or pink tones. And so far, there are no markings. I didn't see any markings. And next is, we will go to the lower extremity of the nails patient so that we can determine if there is markings or color. What is the color of the patient nails? So, as I have observed, there are no markings at all, but again, there is nail polish. And the color of the patient nails is color pink. And this time, I will inspect the patient's nail shape to know if or to determine its curvature and angle. So the patient's nail shape or nail plate shape is square in upper extremities. And in lower extremities, it is also square in lower extremities. And lastly, I will palpate the patient's nail to assess texture and also perform blanch test of capillary refill. So as I have observed, the nail beds of the patient's nail is firmly attached in upper extremities. And I will perform blanch test of capillary refill to determine if the color of the nail will go back or will return to its pinkish color. Yeah, so far there is no abnormalities and it is good. And we will go to lower extremities rather. So the texture of her nails is firmly attached, as I have palpating, firmly attached to nail beds. And I will perform blanching to know whether if the pinkish color will turn back. So far it is good. I didn't see any abnormalities of her lower extremities nails. So ma'am, thank you for your cooperation, for your time, and for your availability this day. And I can assure you, ma'am, that all the results will be confidential and all the results will be only discussed by the healthcare professional. And that would be all. Thank you.
Make sure to remove and discard sterile gloves. Perform hand hygiene.